We describe our vision as being to have a Scotland where all of us have equal access to to good health and to the opportunities that create good health, no matter where we come from. And essentially, this is a strategy that's about trying to reduce what I think is the biggest health challenge Scotland faces, and that's the health inequalities that we experience, the enormous difference in health and life outcomes depending on who we are and where we live in Scotland. What we have is a situation that even in this city, the city in which I live, if we travelled across from the southeast to the northwest of the city, we would see an enormous difference in both the length of time we are likely to live our lives and in the amount of our life that we live in good health. So that really is determined by quite a number of really quite complex factors, but ones that frankly are quite intuitive. So where we are born, our experience of our early life, our parents living in our families, the schools that we go to, the kind of job opportunities that we have, the income that we have, the houses we live in, these all are in evidence closely tied with the kind of health outcomes we have. And so reducing health inequalities isn't just a job for our National Health Service. It's a job for all of our public services, and a job that really needs, I think, very strong civic leadership, strong political leadership, and strong public services leadership. A better Scotland would look like a Scotland in which no matter where we grow up, no matter what our life circumstances, we have a much more even likelihood of living the same kind of long life and the same kind of long, healthier life. So this is measuring things very much from a health perspective, but it extends to many other areas of our life. An example of that might be that the Scottish Government currently, the First Minister said in her new programme for government that her biggest policy priority was reducing the educational attainment gap in Scotland. So our average educational attainment in Scotland in the last 20 years has improved. It's improved really quite substantially, just as our average health in Scotland has improved very much. But there are a lot of Scots, a lot of people living in Scotland that just have not had that benefit. And in some ways, at times we've seen their outcomes drag way behind what that average looks like. So coming back to my example about educational attainment, if we look at what contributes towards improving educational attainment for all kids going to school in Scotland, all kids growing up in Scotland, we'll actually do some of the things that will also improve health and well-being for those children. That's why I said that there's no simple solutions to this. This requires us to think, I think, in a quite different way, right across our public services arena, right across the landscape, to think about the contribution that in the provision of housing that we have, in the way in which we drive education and support youngsters, particularly from poorer backgrounds, do much better in schools, so that they get onto that job ladder, they get onto that housing ladder, and they then enjoy the same kinds of health outcomes that I enjoy and that my children and my grandchildren enjoy. Given the number of partners that we need to work with, I think one of the big differences is that we don't see this as being a job simply for our colleagues in boards across the NHS. We think this is a job for all of us engaged in public services, and I include the third sector in this. Indeed, I include the private sector. Let me give you an example. There's a very strong evidence link about the contribution that levels of income and indeed employment, particularly employment in good work, the contribution that makes to the levels of health and well-being we enjoy. So let's think about how we might then engage with some of the people who are responsible for ensuring people have a good and decent income that allows them to access health services, allows them to enjoy the kinds of lifestyle that will contribute towards their health, an active lifestyle, etc. So thinking about income, there are new welfare powers coming to Scotland. We've been working with government about how they design the implementation and the delivery of those new powers. We are looking at the very strong links between a sustainable, decent income for people to live on, and health. We're looking at the evidence about the importance of a living wage, for example. So these are things that sit, as I say, quite significantly outside of the NHS, but we know from the evidence they have a very, very strong impact on our health and well-being. So we work, for example, with employers right across Scotland. We're in touch with 13,000 employers over the last year about what a healthy working life looks like, about how we ensure that health in a work setting receives attention. And why would employers be interested in that? Certainly, partly because they want their workforce to be happy and to be enjoying good health, but also because they're a more productive workforce. So that's what's in it for the employers. For all of us who spend a very significant part of our life in work, the evidence shows that if we are working in good employment settings, where we have employers who engage us in our work, who make our work meaningful, and who pay a decent return for our work, then we'll enjoy a better health and we'll live longer, healthier lives. You know, for many years we promoted health improvement messages, and we know that that has an impact. It has a positive impact, and that's contributed towards improving Scotland's average health. But we also know, particularly from the social attitude survey, that quite often people know that the damage that drinking too much or eating too much or not being physically active enough can do to them, but they don't act upon that. So that again shows that this is not a straightforward provision of information and then people change their behaviour. And right across the world, there's a recognition that what determines our health goes way beyond simply the way in which we live our own lives and our own health behaviours. So if I maybe can give you a couple of examples. So we've now had for many decades some very strong health improvement messages around about tobacco and about reducing smoking. But perhaps the single biggest contribution in the last 20 years towards reducing smoking in Scotland was the use of legislation to prevent people smoking in public places. Now, the importance of that was recognising the damage people smoking was doing to others' health. That's why in bars and restaurants, this was a really important issue for the health of other customers and for the health of the staff that were there. Introducing that measure has had an enormous impact in reducing the amount of smoking across Scotland. That's one of the things that's improving Scotland's health. It's improving it. You know, less people are having heart attacks and strokes simply as a result of that measure. But there were also some consequences of that we didn't even understand. So the numbers of kids who are taken to accident and emergency departments as a result of their asthma, which had been growing for up to almost 10% per year, all of a sudden plateaued and then fell off. And we know that that's because they're now reduced to much less second-hand smoke. Another example of this would be some of the work that we've done around alcohol. Again, we know about the health advice about reducing our alcohol intake. I can say that with some confidence because as that happens, I'm on a bit of a kick just now, so perhaps I wouldn't have been able to say this to you a couple of months ago. But one of the things that's really important, you'll be aware of the measures that the government has tried to take in the last couple of years around introducing a minimum unit price for alcohol. And that's based on very strong advice, very strong evidence that particularly those who are drinking the most harmful alcohol, the very high strength, very cheap alcohol, do so partly because it's incredibly cheaply available. Sometimes, you've seen from the adverts, sometimes as cheap as water is to buy in the supermarket. So the measure to introduce minimum unit pricing, which has been held up as a result of a legal dispute, but hopefully we might be seeing the light at the end of the tunnel, is a direct example of how we then encourage people's behaviour to be different. We introduce a very strong trigger because, again, from the evidence, we know that the cost of a unit of alcohol is directly related to the amount that's consumed. So some of that very cheap cider, for example, that's drunk to excess by far too many people with harmful drinking habits, that will be tackled much more effectively by introducing a minimum unit price on alcohol than by continuing to deliver simple health improvement messages. So these are a couple of examples of how we might use the work that Health Scotland brings about the research and the evidence that our analysts look at, and then to use that to introduce different policy approaches which will both complement the health improvement messages but actually get to much more the root of the problem. So I think the examples I've given you on tobacco and alcohol might be quite good examples, perhaps less obvious examples. I mentioned earlier on about the extent to which income plays a big part on our ability to lead a healthy lifestyle and our ability to enjoy good health. So one of the things, the government had a couple of big conversations with the people of Scotland last year on health and on fairness. And we were quite involved with this fairness conversation. And one of the things that we responded to the government's request for organisations to make a pledge about how they would make Scotland a fairer place. Our contribution to that was to make a pledge about helping the frontline NHS workforce just by a routine inquiry, if a health visitor or a district nurse or a GP is talking with a family, about an inquiry about how much of a worry is money, and then directing people towards the kind of advice agencies that help them maximise their income, either by claiming tax credits that they're due, or indeed potentially benefits that they may be due, but making sure that that family has a higher level of income. Because again, I go back to what the evidence tells us, families with higher levels of income will generally enjoy much better health, and particularly if those families have higher levels of income, they spend it on things that will make their children healthier and better and feeling better. I described earlier on, we live in a country which I think is far too unequal in terms of not only our population health, but many other life outcomes. And I include employment in that, I include income in that, I include housing in that. Just in very many aspects, we have, I think, quite an unequal society. Indeed, this has become really at the centre of much of our political discussion, much of our public policy discussion in the last few years, and I'm delighted about that. And the reason I'm delighted about that is not only do I want the population of Scotland to be much healthier, but I want that distribution of health and distribution of those other life outcomes to be much fairer. It can't be a good thing for us as a country to have such talent and opportunity squandered and wasted and not contributing towards Scotland's well-being as a country. We know both economically and socially that unequal countries are not as productive and they're not as good places for people to live and grow up in. And that's why Health Scotland's strategy is called A Fairer, Healthier Scotland.